Hello friends, I am Dr. Rahul Joshi, a practicing homeopath in Walkeshwar, Mumbai, and you're watching me on Sify.com, the exclusive website. And well, you've also seen a couple of my other colleagues, senior doctors, and here I am to answer your queries.
Doctor, how is homeopathic treatment approach different from other treatments?
If a patient with migraine goes to a chap of modern medicine, most of them will get the same medication. But in homeopathy is different because we believe every person is different. If I am bored, I may like to go for a movie. Someone else may play a game of golf. Someone else may sing, and someone else may like to spend time in the gym. Similarly, illness is not something different. It's a part of your life. Hence, illness has also to be individualized. And when we have illness, we ask a couple of questions, try to know the different facets and the modalities which come along with the illness, and hence prescribe a drug, a medicine which is highly individualistic. Which means if 10 patients of migraine come to us, we may land up giving them 10 different medications. Yes, and it all depends upon the nature of the person, his likes and dislikes, his past history, his miasm, his family history, a lot of things together. So in a nutshell, answering your question is that there are different personalities, and yes, we have medicine suiting to every personality.
What would be your update on the benefits of a homeopathic treatment?
I would say this way, that our medications need not stay with the person lifelong, number one. Number two, these are not habit forming. Number three, these medications are reasonable and much easily affordable than the other medications. And importantly, that these medications help a body to help yourself. We are not trying to break the flow of the system. We are trying to help the system to overcome itself and to get back to normal. I would say that is the most important aspect of homeopathy, that it mimics nature. It helps the body to help itself.
What is your take on the following notions? Homeopathy is all about habitual and dietary restrictions.
Good question, madam. I would say that any pathy to work well does lay stress on dietetics, does lay stress on habits. There is something called as a maintaining cause. If a person is suffering from cough and he keeps on smoking, then how will it improve? If a person has sleepless nights, he's having sleeplessness and he continues to watch fearful movies at night, or he doesn't have a good lifestyle, how will it help him? If a person has a lot of back pain and he's continuously working the way he should not, he's bending the way he should not, he's burning the candle at both the ends, then how will he improve? Well, the answer to the question is that habits and diet and regimen are important for any pathy, but in homeopathy we give more importance. But doesn't mean that we are sort of bigots about it, that it is required. Well, but it is to a certain extent.
Homeopathic medicines take a longer time to treat or heal when compared to conventional medicines.
Interesting question, and the answer here is negative, which means that homeopathic treatment competes well with any other form, or I would say better, in acute diseases. You get a patient of migraine, of headache, of cold and cough, or fever, or any of these acute complaints. Well, I would say here that if the correct remedy is found, we will treat it faster. But then many patients of chronic long-standing illnesses come to us, skin states, kidney states, certain chronic miasmatic diseases. There are two options here. Whether you go to another person, another practitioner who suppresses these ailments, you feel better, you get a high temporary, only to come and complain after 2 months that I felt better just for a month. In such cases, we advise that why not go slow and steady? Why not remove your problems layer by layer, from more intensity to less intensity, and remove a person out of this malady slowly but surely. I think the person who accumulates runs slowly, okay, plays the ball according to the merit, is more long lasting than T20 players. And that's why Dravid is still the legend.
Homeopathy cannot be advised for surgical treatments.
Absolutely correct, madam. Our founder, Dr. Samuel Hahnemann, the couple of books which you can probably see here, he is laid down certain rules. He has laid down, this is sort of a Bible of our homeopathy. And he says that purely surgical diseases need surgical intervention, period. But today, what is happening is that even if a patient is suffering from XYZ illness where the surgery is not indicated, he is drawn to a surgery by certain surgeons with not good interests, which I would say personal interest. My objection is there that purely surgical cases do need surgery, but lot of cases do respond well to medications even when the surgeons have said you get him another knife. So many cases of tonsillitis where the children have been advised that he has to do away with the tonsils, and we take him over. Within 3 months the patient feels better, his tonsils are no more swollen. A lady of 45-50 who is bleeding more, she is menopausal, and the gynecologist says that you get rid of the uterus, and we object that why, even if it's of no use. That's what it's not so. Even if it's of no use now, even if the reproductive age is over, you have 2 children, get off it. But we say no, let us give a fair trial of homeopathy. We give, and the fibroids or the bleeding stops, and I would say the uterus is preserved. So friends, my answer to the question which madam has asked me is purely surgical diseases, surgical cases where surgery is indicated. There is a tumor, it has to be removed, appendix has to be removed, there's a patch of the intestines has been ulcerated because of some reason, it has to be removed. Well, go ahead. But all cases need not first treat medically.